nursing. Hi, I'm Debbie. I'm your nurse today. What's your name and date of birth?
Nicholas Berkeley, October 23rd, 1990.
I'm here to do a physical assessment today, and first of all, I have some questions for you.
Okay.
What day of the week is it?
It's Wednesday,
What is the year?
2018,
What's the month?
November.
Okay, and where are you located?
I'm in the hospital.
Okay, so it's obvious that Nick is oriented to 4, and he's alert, person, place, time, and situation. I'm gonna, as you saw him walk across, he's mobile. I have a question for you. If you saw a house on fire, what would you do?
I would call 911.
Okay, and it's obvious that his judgment is good. He is 28 years old. His height and weight is appropriate for his age. He's being cooperative. His behavior is good. He's looking me in the eye when he answers. And now I'm going to go ahead and explain what we're going to do. Basically, I'm going to do a head-to-toe assessment, and I will be palpating you and touching different areas, and I will also be percussing where I hear a sound on you, just on your chest and your back. If you have any tenderness at all during the examination, please let me know, and then we'll go into more detail in that area. Do you need to go to the restroom?
No, I'm good.
Okay, well then let's get started. First we'll start with the head. Your head is normal cephalic. It looks like it's symmetrical to your body, and your face is symmetrical. Your hair distribution is even. Go ahead and open and shut your jaw, and it seems like all of the plates in your skull are in good shape, in the right spot. I don't feel any lumps or lesions or anything on your hair. Okay, now next, I need to go ahead and do your sinuses. This is your frontal sinuses, and these are your maxillary sinuses under your eyes. Is there any tenderness there?
No.
Okay, next we're going to go on to your eyes. I see that your sclera is white. Can you pull down your eyelids? And your conjunctiva is pink. Your eyelashes are evenly distributed, and your eyelids don't have any styes on them, etc. We need to go ahead and do a vision test. Here is a card that you're going to put in front of one eye and then the other eye to block it. Here is our Snellen chart, which I will go ahead and put up 20 feet from the patient. Go ahead and read the lowest line that you can interpret.
DEFPOTEC.
Very good. Go on, do the next one.
DEFPOTEC.
Very good. Now do it with both.
DEFPOTEC.
As you can see, Nick has 20/20 vision in his left eye and his right eye, and both together while using corrective lenses.
Mm-hmm.
We need to go ahead and look in your eyes. So I'm going to need you to take your glasses off. First of all, go ahead and look at a point up on the ceiling, far away. And then, okay, I see his eyes. And now look at my finger. Okay, and basically, this showed that his pupils were about a 5 millimeters, and then when they dilated, they became about a 3 millimeter, and they converge correctly. So I'm going to go ahead and look for the red reflex. And I see the red reflex. And I see the red reflex. So his eyes are equal, round, equal, reactive to light, and we're pretty much done with the eyes now. Next, we're going to go ahead and do your nose. So it is symmetrical on your face. I need to look up inside your nose. I see that it is pink. I see some cilia. I see the turbinates, and your septum is not deviated. I see the same thing on the other side. Your turbinates, pink, no discharge. Okay, your nose looks good. Now we need to go ahead and do the sniff test. If you could block one side of your nose and tell me what you smell.
Garlic salt.
And shut your eyes and...
Cinnamon.
Okay. Thank you. Now, next I need to change this into an otoscope so I can look into his ears. First of all, I'm going to palpate his ears. The pinna, the outside, feels mastoid bone, and the tragus. And the tragus on this side. Is any of this tender?
No.
The pinna and the mastoid bone. Okay, now I'm going to look into his ears. And what I do is I pull up and back, and the otoscope goes towards his nose, and I see it's pink. I see the landmark bones. I see a little bit of wax. I see his tympanic membrane, which is pearly gray, and the cone of light, which is at 7 o'clock. Okay, if you could turn this way. I pull up and back. I see the pink, little bit of wax, a pearly gray tympanic membrane, and the cone of light, which is at 5. Okay, now we need to do the whisper test to check your hearing. Okay, go ahead and block one of your ears. 5G6.
5G6.
Okay, now block the other ear. 4K2.
4K2.
Very good. Okay, so your hearing seems to be intact. Okay, next is your mouth. I need to check your lips are not cracked. I see that you have all of your teeth. Your gums look healthy, they're pink. I see your hard palate is white, your soft palate is pink, your tongue is pink. I see your uvula and your tonsils back there, and everything looks like it's intact. Next we need to do your neck. First let me feel your carotids, and there's an amplitude of +2, and your other carotid amplitude of +2. Next I need to listen with the bell to make sure that there's no bruise in your carotids. And there's no bruise, which is normal. find your, okay, put your head down. I can see that your trachea is not deviated, it is in line. Okay, the next thing we need to do is the thyroid, and I need to come behind you, and you're going to lean your head forward and to the side, to the right and to the left, and that you're going to take a drink at the same time. Okay, lean forward. I feel the right side and the left side. And very good. Okay, if you could spin around so that I can go ahead and check your lymph nodes. There is the preocular, the postocular, the occipital, the tonsillar, submandibular, submental, superficial clavicle, or superficial cervical, posterior cervical, deep cervical, superscapular, or
Clavicular.
supraclavicular, and infraclavicular. And that's part of your your upper extremities. Also, we have the central lymph nodes, the lateral lymph nodes. I need to get in here. The pectoral lymph nodes and the subscapular lymph nodes on that side. Then we have the central lymph nodes, the lateral lymph nodes, the pectoral lymph nodes, and the subscapular lymph nodes. Okay, there's no tenderness in those, and I didn't feel any enlarged nodules. Next, I need to look at your arms, and they're warm to the touch, not a lot of hair. Okay, I'm going to go ahead and do your brachial pulses, and there are 2 amplitude, and your radial pulses, and there are 2 amplitude. Your capillary refill is less than 3 seconds, and your nails are more than 160 degrees and more than 160 degrees. Okay, next I need to do your arms. I mean, not your arms, your back.
Okay.
That was your arms. Okay, so if you can turn around so I can look at your back. Okay, first of all, let me look from the side and take a deep breath. And your AP diameter is 1 to 2. Related to your back, I need to go ahead and feel your sphygmomatosis processes. Are any of this tender?
No.
Okay. Now I'm going to need you to take a deep breath a couple times, and his chest expansion is symmetrical. Okay, this is one of the places I need to percuss, so I'm going to go ahead and do that. And that sounds resonant and fine. Next, I need to go ahead and listen to your lungs. If you could take a deep breath, kick deep breaths. lungs are clear bilaterally in the upper, mid, and lower lobes. I'm going to need to do a CVA tenderness test. It's under your kidney here. I'm just going to hit my fist real quick. Was that tender?
Nope.
Okay, good. We're moving on to your anterior chest now,
Let me
the
just
front
take this
chest. You just want to take it
Yeah.
off? Okay. This might be easier. Okay. The first thing I need to do is palpate his PMI, and if you could exhale and then hold your breath for a few minutes.
For a few minutes.
Or a second. Okay. I need to go ahead and do your lung sounds. If you could take deep breaths. And his lungs are clear bilaterally in the upper and lower lobes. Okay, next I'm going to go ahead and just breathe normally. I'm going to take his respirations, starting now. Okay, it's been a minute, so it's 18. Next I need to go ahead and listen to your heart. Valves. Listen to the aortic and pulmonic, Erb's point, tricuspid valve, and the mitral valve. And I'm going to go ahead and take his apical pulse, if I can find on my watch, my second hand. Okay, and get a 72. Also, I need to do the same area, again with the bell. Aortic, pulmonic, Erb's point, tricuspid, mitral valve, and I only heard S1 and S2, not anything else. Since I've got this out, and I've got my bell, I'll go ahead and listen to your aortic arteries, see if there's a bruit, and your renal arteries. And your femoral arteries. And I don't hear any bruits. Let me go ahead and feel the pulse of those so I don't forget. And it's a +2 amplitude, +2, and +2. Okay, next, I'm going to need you to lie more flat because I'm going to go ahead and do my palpation and my percussing. Before I start that though, let's listen to your bowels. Sorry.
It's okay.
You are hungry. I definitely hear gurgling in all 4 quadrants. Okay, as he's laying down, I see that his contour is flat and his skin is warm. Okay, right now I'm doing light palpation. Is there any tenderness?
No.
Okay, here's deep palpation. No tenderness?
No.
If you had appendicitis, I might do a rebound tenderness test, which I would go down at a 90-degree angle and do a quick jab, which I'm not going to do right now, like that. I need to find your liver is right. I can feel your liver right here. I'm trying to think if there's anything. I need to do your hernia. I need to see if you have a hernia. So, if you could lift your head up, and I don't see any. Okay, go ahead. You can put it down. I don't see anything popping out, so I'm sure you don't have a hernia. And I think we're done. And percuss. I need to percuss you. This is the other place I percuss. Okay, and everything sounds good. Now, if you want, you can put your head up. You don't have to be so flat. We still have to do your legs. First, there's even distribution of your hair, and your legs are warm, dry to the touch. Your feet are a little cold. Okay, if I'm doing the capillary refill, it's less than 3 seconds. You need to do your dorsal pedis pulses are +2 amplitude, and your posterior tibial are +2. I don't see any edema on your legs at all because you're in good shape. And then we are done with that part. You can go ahead and put this back on, and we'll go ahead and do your cranial nerves. The first cranial nerve is your nose again. So, if you could shut your eyes and close one of your noses, your nares. What does that smell like?
Garlic salt.
And what is what is this one?
Cinnamon.
Okay. Cranial nerve number 1 is intact. Now your cranial cranial nerve number 2 has to do with your eyes and your peripheral vision. You put it up to one of your eyes, I'll put it up to the opposite eye, and tell me when you see my fingers wiggling.
Now.
Okay, let's do the other side. And when do you see my fingers
Now.
wiggling? Okay, very good. Cranial nerve number 2 is intact. Cranial nerve 3, 4, and 6 have to do with your eyes. The first test is a cover and uncover, cover and uncover, and you've passed. You have positive or negative for strabismosis, which is cross-eyed. Next, we need to do the cardinal points, the 6 cardinal moves. So look at me and do not move your head, and just follow this with your eyes. And he seems to follow it fine. And stay over here for 3 seconds. And I see that he's negative for nystagmus. That means that cranial nerve 3, 4, and 6 are intact. The next one is cranial nerve number 5, which has to do with your jaw. Go ahead and clench your jaw, and I can't pull it forward. I also keep your jaw clenched, and I'm going to shut your eyes, and I'm going to put something dull and something soft and on his forehead, his cheek, and he's going to tell me what it is.
Soft. Dull.
And his chin, or his jaw.
Soft.
Sorry. Okay, thank you. Cranial nerve 5 is intact. Okay, cranial nerve 6 has to do with your face, or 7, because we've already done 6. Go ahead and raise your eyebrows, and smile, frown, and puff your cheeks out. Okay, cranial nerve 7 is intact. Cranial nerve 8 has to do with hearing again, and I'm going to use the tuning fork, the Weber test. I'll hit it, put it on his head, and he'll tell me whether or not he can hear it evenly in both of his ears.
Yes.
Okay, and cranial nerve, the Rhine test, I hit the tuning fork and put it on his mastoid bone, and you tell me when you cannot hear it, and then I will move it forward and he'll listen near his ear and tell me when you cannot hear it, and I have to do it for each ear, obviously.
Can't hear it. Can't hear it.
Okay, now on to the next one.
Can't hear it. Can't hear it.
You have good ears. And he has a positive Rhine test. His air current conductivity is greater than his bone conductivity. Now we're on to 9 and 10. Go ahead and take a drink and let me see you swallow. Okay. And we need to look in your mouth. Can you open it up and say ah? And I saw your uvula go up and down, and obviously his gag reflex is intact. So cranial nerve 9 and 10 are intact. Cranial nerve 11, I'm going to push on your shoulders and you shrug them up. Okay, and now push on my hand with your face, and turn and push on my hand with your face. Okay, cranial nerve 11 is intact. Lastly, number 12, cranial nerve 12, stick out your tongue and go up and down and side to side, and cranial nerve 12 is intact. Now we're on to the musculoskeletal. On this part, you're going to have to go ahead and stand up. Okay, first of all, let me look at your legs. And, okay, I was checking to see if he had any varices or varicose veins. I did not check that part when he was on his I was looking at his lower legs, because it's better if you're standing. Okay, musculoskeletal is about range of motion. So, can you put your arms behind your back? Okay, and clench them. Okay, and also go ahead, you can put them down now. Twist your body and go to the side and go front and then back. Okay, so his range of motion looks good. Go ahead and lean over, and I'll see if you, and try to touch your toes or just dangle. Okay, and his spine looks straight. Go ahead, you can stand up. So he does not have scoliosis. I'm also looking to see if his shoulders and his iliac crests are in alignment, and they look like they are. And he's standing with good posture, erect. Okay, we're going to go ahead and since you're standing up, we're going to do some of the neurological tests. I'm going to watch your gait, so go ahead and just walk straight ahead. And your gait seems smooth. Okay, and stop. And now go ahead and walk heel to toe, and then stop. Okay, turn around. Now hop back. Okay, very good. Next, I'm going to have you shut your eyes. Put your arms out straight to your sides and touch your nose with your index finger. This is for fine motor skills. Okay, you can stop. Now open your eyes, and on your fingers, touch your fingers to your thumbs and go back and forth. Okay, his fine motor skills are good there. And if you could stand here, shut your eyes, put your feet together, and we'll do the Romberg test. And he's got very good balance. Okay, you can stop. I think, yeah, this is it for as far as the musculoskeletal when you're standing up. So go ahead, you can sit back down. And we'll do the range of motion for your arms. Go ahead and roll your wrists, put your arms up and down, out to the sides. Okay. Then I need to, I'm going to hold your elbow, and you're going to push against me. Okay, let me see the other arm, very strong. Go ahead, do the other, very strong. Okay, can you open your hands and your fingers back and forth? Okay, so next I need to do some sensation tests. What I'm going to do with the tuning fork is hit it and put it on one of his knuckles, and he's going to have his eyes shut, and then one time I'm going to put it and it's not going to have a vibration, the other time it's going to have a vibration. See if he can tell me if it has a vibration or it doesn't. Okay, go ahead and shut your eyes.
I feel vibration.
Okay. stop it.
I don't feel a vibration.
Okay, can I have your other hand?
I don't feel a vibration. I feel it vibrating.
Okay, very good. On to your, now on this part of the sensation test, I have something sharp, something dull, and something soft. You're going to tell me if it's closer to your hand or closer to your shoulder.
Okay.
And what it is. Shut your eyes.
Soft, closer to wrist.
Oh, well, here.
Dull or sharp, closer to shoulder. Sharp, closer to wrist. Dull, closer to shoulder.
Okay, very good. The next test is for stereognosis, and we're going to see, you're going to go ahead and keep your eyes shut, open up your hands. I'm going to put something in each hand and you tell me what it is.
A quarter and a paperclip.
Okay. Also leave your hands open. I'm going to draw something on each of his hands. This is a test for graphonesia.
Letter A. Number 8.
Okay, very good. Okay, now, one more thing. Put your hands out like this, and I'm going to push, you need to keep your eyes shut. I'm going to push down on one finger and up on another and tell me which one I did.
Up. Down.
Okay. I think we are done with your arms. Now we're going on to your legs. I'll go ahead and do the thing on your toes when it's down and up
Okay.
again.
Down. Up.
Okay. Then we need to go ahead and do range of motion. So you need to lift your leg up and out and roll your ankles, and your joints look good. Okay, now I'm gonna have you put your knee up and push against me. Okay, push against me. Okay, and I'm going to push down on your toes. You resist. Okay. Now I need to do the tuning fork. Again, you're going to shut your eyes, and this time I'm going to be doing the same thing I did with your hands. Tell me whether or not you feel the vibrations. And I'm going to put it by your great toe, like between your great toe, your big toe, and your other toe. Oh, thank you. He opened it up for me.
I feel the vibration.
Okay.
I don't feel vibration. I don't feel vibration. I feel vibration.
Okay. Very good. Now let's do the same kind of test that we did earlier with the sensation. Tell me if it's closer to your ankles or your hips. Let's pull this up so that there.
Dull hip. Soft ankle. Soft hip. Sharp ankle.
Okay. Very good. Now, I think we are on to the last part where we have to do the reflexes. The first thing I'm going to do is the Babinski reflex. since he's sitting like this. And he's not positive for it, but his toes don't really totally curl.
No.
But he's not positive. Okay. Go ahead and swing around, and we'll do your legs first. Do your patella and your Achilles. Need to do your brachial radial. Your biceps. Okay, and then put your arm, hang your arm down so we can do the triceps. And we are done. Thank you very much for your time, and thank you very much. Have a great day.